You think about the progression of healthcare over the last, couple decades. We went from paper charts to electronic records to, kind of siloed information to now information sharing platforms. I mean, it really has changed. AI is the next frontier, and I think people today, I think what I'm realizing, and this is even over the course of the last 2 years, if you're not on the AI train right now, you're behind. You're going to get left behind a little bit. And I know, I get it. There's a lot of angst still. Obviously, we grew up in a generation where, AI wasn't necessarily portrayed in the best way, and there's always, a little bit of reluctance there. And so ethical AI ethics in the AI is going to be a real big thing as well. But I think that from a way to connect to people and help them expedite, I think it's kind of the next wave of things we have to do. And let's not forget the generations that are in that mode right now. If you think about the X's and the groups that are coming through, we're not, technology, avert. We are, I think, we're in a good position to be able to maximize that. And we're in a position where we also want support and services when we want them. The traditional models of, oh, I need a question, I have a question of this, well, I better make an appointment to go to the clinic. That's really going by the wayside level. So you have to adapt that way. And sometimes, that's where AI, I think, really starts to bridge the gap for you, because sometimes I think, and this is what I've been seeing and hearing, and as I've kind of been involved in some different forums, sometimes what a patient needs or what a person is looking for is just some reassurance or an answer to a question, or something that you maybe don't necessarily need a provider for, or a staff person for. Sometimes you do, and you got to have those abilities to do that. But that's sometimes what we're looking for as consumers, as well as, as everybody. We want an answer or something in more real time. So AI does that. I think it helps bridge the gap for that. It helps answer some of the things that people would traditionally have to do. But I think the other part is that AI is really going to be the idea that there's an AI assistant for everybody in the organization is something that is a concept that I think blows a lot of people's minds, because whether you're working a front office or you're working, checking patients in as a clinical support person like an MA or an RN, or you're a provider, or even post discharge, AI is going to expand to the point that when you're in the middle of your scope of work and the things that you're responsible for, AI is going to give you suggestions. It's going to help you queue up the things that you do that you normally. It's going to be that partner, if you will. I think that's going to help make your job so much easier and faster. And that's a concept that a lot of folks I think are gravitating to. I think there's people that might be a little reluctant, and a little slower in adoption, but I think AI is going to be a great suggestive resource sort of assistant, for everybody.
I'll tell you, kind of to what you said, just being that virtual employee per se, right? And being there when you didn't even know you needed it. I've seen this actually happen in the aviation industry before AI became very prominent as
Yeah.
it is today. And I remember 2, 3 years ago, as I was facilitating in there, start to bring in AI, but they weren't calling it that. But it was that as someone was talking on the phone, it's hearing the conversation and it's already pulling where to find it. It's pulling what to show next. It used to be where we had to go to this knowledge base and, type in the keyword, but now it takes a little longer.
Yeah.
But yeah, man, it is, and it's cool. Like to think, I don't got to go find it. It found it for me. The conversations become a little bit more, just more exciting because you don't have to sit on pause for, well, give me just a moment. I got to wait 2, 3 months. No, it's popping up for you. Like, how much better can it get? And now what I hear though is that people are saying, well, for underserved communities, it's not working, right? That could be, so there's a fear of this tech gap. How do you make sure innovation doesn't leave patients behind when you think about the communities that you serve?
Yeah, and that's something that if you think about, a few years ago, the access to internet service, for instance, was something that everybody was worried about. Is not everybody has it. It's not equitable. There's issues there, and there still are pockets, of course, that happens. But I think we have to rely and we have to partner with our legislative groups as well, our teams, to say, look, that is a connection piece. If we don't have those things, that creates these gaps, that creates these chasms that are going to hurt us in the long run when it comes to keeping patients connected. The reality today is that anybody who's part of a health system or a health organization, you're going to do more and more things through an electronic means. And so you have to have access to, so we need support, obviously, to make sure that that's happening. From our side, the thing that we have to do, because at the same time, back a few years ago, not everybody had a cell phone. And then not everybody had a smartphone, right?
Mhm.
Today, everybody pretty much has a smartphone, at least the vast, but even patients that are at underserved communities, everybody's going to pull a smartphone out. But we have to help educate them on how to use that, right? How do you actually use the technology that you're investing in to show benefit, to bring benefit to them individually? Because once you tell them, look, you can schedule an appointment this way, you can ask for a medication refill this way, you can send a message to your doctor. You do all these things that I think help maximize the use of the things that they have at their disposal. I think that's changing and evolving, and I've really seen that movement, I think, in recent years.
So you're saying seniors can adapt because we always hear the opposite of it, that they can't. I'm pretty sure you being in this space, what surprised you most, I guess, about that generational shifts in tech? Because listen, when I talk about the aviation industry, there was times that I was have because at one point I was in the phones. That's how I started my career in aviation. And yeah, you'll get your people that were 50, 60 years old and act like they didn't want to adapt, right? Can you help me book my ticket? And I'm sitting here like, I can walk you through it. I'm always one like, let me teach you, let me walk you through it. But some people's like, no, I don't know how to do it. But then I get somebody that's 70, 80 years old that is doing it. So you can't tell me it can't be done when I'm seeing it done, right? And you've been in this space, you're probably seeing it done while others are saying they can't do it. What is your thoughts on it?
Yeah, I mean, absolutely, and in the generations, we're getting older. Again, we're not we're more tech savvy, of course, than our grandparents were, and even to some degree our parents. So that evolution by itself is naturally kind of lending itself to a population of seniors, quote unquote, that actually I think is able to do some of the things that are there. So I also, because I've been at this for a while, I do come from a time where I would have physicians say, I'm not using the computer. I'd have people say, I'm not never going to go into the computer. I'm never going to use the system this way. Guess what? You don't have any of that anymore. Everybody moved. So I think that that wave is moving. I think it's going. I think we have to give more credit to really what people can do and what they can learn to do. And I'll tell you, at least speaking for like the San Diego landscape, um, when you join a health system, again, going back to any of those, it doesn't matter any of the big players that are here in our county. It isn't well, if you'd like to. It's no. It's, oh, by the way, here is your access. Here's your log. Like they connect you right away, and I think that's what sets the stage, right? You have to again help people take that step. So you set the stage for it, and if they need it, you offer the support. I mean, that you can't lose that. You have to keep that so that if they do need it. But today, like I said, with that generational movement that's occurring, those caretakers, guess what? They're me. Those are the people that were taking care of our parents that are in that age. We can absolutely help bridge some of that, and it's going to take everybody. But we're going to get to the point that people are going to say, "I got this." Let me take care of it, kind of thing.